few years ago, I was working in a Red Crescent training hospital in Istanbul, teaching nurses, young student nurses. We had very few ESP resources, in fact none. All we had were some medical books, a training dummy, and some very willing minds. This book is the book that I needed then. Certainly with the writing of the first book, I had those pupil nurses sitting next to me in my mind, and I was writing it for them. I was thinking of them as I compiled the book and compiled the ideas for the book.
The book's suitable for nurses who are in training to become nurses, especially nurses who are thinking of working in English-speaking countries. It'll give them, by the time they finish the two books, they'll have a broad vocabulary which covers most areas of nursing that they're likely to be involved in. It'll give them a solid basic grammar, and they will have done an awful lot of speaking. Their confidence in communication, which is so important, will be very strong. It's also suitable for nurses who are in service in countries where they have to work with international patients and use English as a medium of communication. And it'll give them, in the books, they're full of everyday nursing situations. A lot of the standard nursing procedures where they interact with patients are covered. So that's kind of gives them a foretaste of how they'll be talking to students in English when they're on the job, and also it gives students a lot of the study skills they need for their training course. A lot of the writing tasks are based on what they'd need to do during their studies.